All right, Jon. Well, thanks for sitting down and agreeing to talk. It's great to meet you, and welcome to the show.
Yeah, absolutely. Thank you. I appreciate it.
For sure. I think for a lot of people, myself included, the first thing I am curious to get your thoughts on is just what is ketamine, and how did you personally get interested in what it is and how it might be able to help other people?
So, ketamine actually, it's been around for a long time. In the 60s, they approved it and started utilizing it for anesthesia, and then it moved into kind of veterinary medicine. Mm-hmm. And the main reason why it was used significantly in the veterinary world is because the safety panel with weight-based dosing. That was the really big thing. It was just really easy to draw up a dose based on the weight of the animal, and still be able to administer it safely without having to worry about respiratory depression and other things like that. And it was probably in 2006, the National Institute of Health actually did a study using ketamine and looking at it for the efficacy on treatment-resistant depression. That study was extremely successful, and the protocol they used during that study was a weight-based protocol that was actually 0.5 milligram per kilogram, and it was delivered intravenously over a 40-minute period. So that was the protocol they used, and that was kind of the original protocol that most ketamine providers loosely based their delivery off of. And with the all the combat in Iraq and Afghanistan, the military operations were starting to utilize ketamine more frequently in the battlefield because of that same safety profile. It doesn't cause respiratory depression, as opposed to, if you hit somebody with morphine or fentanyl, very easy, you could stop them from breathing, and then you've got to manage their breathing while you're trying to manage everything else. And ketamine was much easier to use, and having just a intramuscular injection of it also allowed the soldiers to be dissociated from what was going on, because let's say, for instance, you get blown up from an IED, and literally your legs are blown off. Nobody really wants to be around for that reality and live through it. So if there's something that can take care of the pain and also, get you to check out, then there's less trauma from the mental health aspect. So they started to see a reduction of PTSD symptoms later on. There's still some controversy on, utilizing ketamine on a prophylactic basis before the trauma happens. That really hasn't been tested and shown to be as effective, but they started to see, the soldiers that, got ketamine out in the field, and when they went through their recovery, they showed less clinical signs of, PTSD. And that was, kind of the catalyst for ketamine to start coming back into the industry on being more of a mainstream medication and more familiar with just healthcare providers in general.
Is it fair to say that is what started, as you said, sort of its resurgence back into, the interest in the mainstream of medical science was really first in wartime usage, and then after seeing the efficacy and the way in which ketamine might be beneficial, seeing the potential for potentially using that in non-military environments.
Yeah, I mean, so the interesting part is most of our medicine and our medical breakthroughs come out of wartime. With my background being a paramedic in EMS, Vietnam was huge for the development of pre-hospital medicine. Kind of like helicopters and, medevacs, that's kind of where that started to catch on. So, we're starting to experience the same thing, but this one is unique because it's for mental health. And that's an area that, as a nation, we have kind of dropped the ball on being able to manage effectively and, get a good grasp on, the real heart of the issue, because it's just been within the past, I would say 10, maybe 15 years, more like 10 years, that we've started to actually try to break the stigma around mental health and, actually needing some assistance.
Yeah.
So wartime has been extremely beneficial for, the evolution of medicine, but it's also brought up a lot of weak points that need to be addressed with the mental health aspect, and, vets are kind of, they're a focused target group that are easy to study and analyze and to see if things actually are effective in treatment like that. So that's the reason why a lot of the medical breakthroughs, are used out of wartime, because that's when you have the liberty to forego the intricacies of informed consent.
Yeah. Yeah. A sad reality, but a potential silver lining in that, that history. In terms of ketamine as a drug itself, and I feel like at least in American culture, there's a lot of buzz around psilocybin use these days and MDMA therapy trials, and ketamine is not quite, in my experience at least, as well advertised these days as some of those other substances are. As a drug, is it something that is a naturally occurring substance in the natural world like magic mushrooms? Is it something that a scientist accidentally invented at one point in the past? What's the genesis story of how it was extracted and isolated as a substance?
So it's completely synthetic, and when ketamine was actually developed, it was developed because PCP had too many side effects.
Really?
Yeah. So it actually targets a PCP receptor site in the brain. So that was kind of the motivation for the synthesis of ketamine, was to find a dissociative medication that would have the safety profile and not affect the cardiac and respiratory systems as significantly as some of the other medications, and still allow a person to dissociate away from the current situation and what's going on. Yeah. And I think we saw it in the 80s with PCP, whenever PCP was used recreationally. The side effects and just the degree of psychosis from PCP made it ineffective as a legit medication that could be used in a controlled environment. So once they were able to synthesize ketamine, they found that it had, very minimal side effects of it. a lot of times it's referred to as like excited delirium is what a lot of pre-hospital providers know it as. And it's just pretty much where, the person, is completely checked out mentally. They're not there. And, there's no speaking with them, and they're acting completely irrational and violent and typically, injuring themselves.
Yeah.
So when ketamine came around, it made it very easy to use for pediatrics, and, using it during anesthesia in extremely controlled environments with other medications made it a very easy drug to work with that you didn't have to worry about really prolonged recovery times or a high incident of adverse side effects.
I think if people hear, I didn't know that it was I don't know if cousin is the right word, but it was an offshoot or a reaction to the negative side effects of PCP. Are the two drugs at all related, and are there any similar effects in an individual? The image I'm getting in my head of PCP is exactly as you just described, someone who is psychotic and self-harming and is just, for lack of a better word, acting crazy.
Right.
Are any of those symptoms generally found in ketamine? Are there any parallels that you think you notice between usage of the two drugs, or are they totally different in how they affect a human being?
So the ketamine, if you look at the structure, the of the molecule, it's very similar to PCP. And, it's very similar to DMT. And like with most psychedelics, whenever you start to dig into their organic structure, you'll start to understand a little bit more on why a lot of them have some of the same, responses. And, we're starting to see that they're effective for treating some of the same mood disorders and conditions. And with ketamine, the irony is it's actually contraindicated for somebody who's in a manic episode or a psychotic state or something like that.
What does that mean exactly?
So if someone who has bipolar, typically they have depression, and then they have moments of, manic mania. And it doesn't have to be, completely manic. It can be hypomanic. There's different, degrees of it, but, it's a wax and wane. You go from highs to lows. And since ketamine is a dissociative and it's confusing, it's weird, it's abstract, it's hard to describe. And, a person's experience on ketamine has a whole lot to do with the external variables and a ton to do with their mindset when they come in. So if you're already in even on the verge of being in a manic, just, having flights of thought and just completely irrational, and then ketamine kind of just will help be a catalyst to kick that in, and, you can run into those issues with the treement.
You mean it could exacerbate the problem?
Yes,
it could amplify it.
Yeah.
Okay, yeah.
So that's the big one when, we're doing patient selection and intake, and, everything with that is just to try to look for all of those potential areas that could be troublesome, so we can avoid those, because it's not contraindicated for bipolar patients. It's actually pretty effective. You just have to ensure that they're not on that, that manic or, hypomanic side of, their illness at the time of treatment.
I see. Okay.
So,
provided that day they are in a more stable state, it would be reasonable to think that they could have a pleasant experience on that.
Absolutely.
Okay. Gotcha.
Yeah. And, even if you're not diagnosed with bipolar, or you truly don't have, something that would be clinical mania, if let's say you were scheduled for treatment and you got a telephone call that your mom died at 10 o'clock that morning, I would probably recommend that you reschedule your ketamine treatment, because coming into any psychedelic experience with that negative mental state, that psychedelic experience is just going to exacerbate what's going on mentally at the time, unless you're able to meditate or get yourself out of that state prior to your journey. Otherwise, it's going to be a very turbulent white knuckle experience.
Gotcha. Yeah.
But ketamine, similar to other psychedelics, it can kind of exacerbate or emphasize whatever mindset you're in whenever you come into the experience.
Okay. And in terms of the time frame of the creation of ketamine, was it intentionally synthesized as a way to get some of the benefits of PCP without the negative side effects, or was it discovered completely separately from PCP? And when is this, the 80s we're talking about, when it was initially synthesized and created, or what's the time frame there?
1960, in the 60s. I don't know exactly which year, but no, it was intentionally synthesized to try to diminish the side effects that were associated with PCP.
And just to dig in on that a little bit, was PCP at the time being used in a medical context, or were people just addicted to it and they wanted to synthesize a drug that didn't have the adverse side effects of PCP in recreational use?
Well, with PCP, it actually didn't start being recreationally used until much later.
Okay.
So it was just in the medical industry when they were doing, a lot of drug discovery.
Yeah.
Back during the time, this is, the time in which we had a significant amount of drug discoveries.
Yeah.
They started to toy with it, and I'll just say that the United States government has been working on a lot of different things over the years that would be advantageous for a nation and national security and stuff like that whenever it comes to certain operations. And that was, some of the motivation was, some national security and military development and intelligence. And, because, under the influence of a psychedelic, you can elicit a fair amount of information from someone.
Right.
Once this is extremely true with ketamine. It knocks down your emotional defense mechanisms, your natural barriers that, your mind and, your brain puts up to resist certain things. And so you're much more open and much more at liberty talking about different things. So it does kind of, loosen up the lips a little bit and make someone a little bit more pliable. And that was a lot of motivation with it.
Okay. And at the time in the 60s when PCP was, it sounds like not yet a recreational drug, but was being used in a medical context, was PCP primarily being used as a disassociative or being used in a field of battle? What was PCP's use in a medical context prior to ketamine being synthesized?
So it really didn't have a specific use that they were shooting for.
Yeah.
It was just they started to develop it, and once they started testing it, it would affect the patient or whomever it was administered to in different ways. And specifically whenever it comes to national intelligence, if you can administer a medication and to help out with questioning, it really helps develop the use of that. And I think when, a lot of the investigation was being done, once again, you go back to military, it's a very focused population that you've got a lot of liberties with. And, even look at some of the other, college trials that they did back in the days, the Stanford project and stuff like that. It was, there was a lot of investigation about mind control and just looking into, how certain chemicals affected people's ability to have that control over another individual. I mean, it was really a odd time.
Yeah.
And that was a lot of motivation. I mean, we were in the Red Scare and there was a lot of things that were going on. And, the concern was if we don't find out what it does and how it works and how it affects us, then we could fall prey to somebody else using it. And then, once we investigated the, kind of the intelligence and the clandestine methods of use, I think the spillover to, legitimate, actual, patient care, utilization started to become more common practice because you started to see, when you gave it to somebody, this was, the effect, and, physicians and other providers that were administering it started to see, oh, it causes this, so it may be beneficial for this. And one of the really interesting things that it's used for today, even in emergency rooms and stuff, is called conscious sedation. So let's say you've got a dislocated shoulder, they can give you a little bit of ketamine, and they'll probably give you, some type of IV benzodiazepine, Versed or something like that, and they'll relocate your shoulder, and it works pretty well because it doesn't knock you out. You get your shoulder relocated, and you're able to recover and be discharged from the ER within a couple hours. Although you'll need a ride home, but you'll still be able to be discharged and go home.
And so, in the time frame, so it sounds like in the 60s it was discovered and synthesized. For the following many decades up until the relative present, what was going on with ketamine at that time? Was it being used in clinical scenarios during that time? Did it completely go underground? What's kind of the story from its creation? Some of the testing that began to happen related to ketamine and what its potential benefits could be up to now. Was it always available? Did it become incredibly difficult to access? What's that story?
A lot of it. So when it first, became synthesized and they started to see some of the actual legit properties it could be useful for in a clinical environment, it did get FDA approval as a anesthetic, utilized during anesthesia purposes, and with the safety profile, it really didn't have too many disqualifiers for patients. So as long as it was administered in that type of environment, then that's how it was being utilized at the time. And then it started to be used more in vet medicine as time progressed. And then probably, in the 80s, early 80s is whenever, there was, and a lot of recreational use that developed in the 80s was from kind of an uncontrolled vet market that made, ketamine a little bit more available to the black market.
Yeah.
It was easier to get your hands on something that's being given in the vet world than in the human world. So that kind of, help encourage the recreational use of it. And, although it was the recreational use of ketamine is typically cut with something else. It's typically not just pure ketamine. And because a lot of patients, after they go through a treatment, in a clinical setting, they're like, I could never imagine using this in a club or something like that, being around a whole bunch of people in an uncontrolled environment. And I agree. It'd probably be a little stressful, but, that was the time in which MDMA started to also come around. And, it's kind of been a human instinct for us to seek out certain chemicals that are going to, distract us from normal reality of every day. Especially now in the times that we're living, everyday life isn't as dreamy as it used to be. So seeking those opportunities to, have an experience that's beyond what your physical senses can see, touch, and feel started to catch on to a lot of people because although it wasn't an intentional thing, most patients that started to use psychedelics in a recreational environment and those that had positive experiences typically had, a perspective shift in their life and, that they experienced some sort of, transcendental moment or shift in their personal reality. Yeah. And, it's contagious. I mean, when you see people smiling, you want to smile too. So, when something starts to work, it does catch on like wildfire because it's like, holy cow, this does have the potential to be really useful. Yeah. But at the same time, the biggest disadvantage we had as a nation was Richard Nixon. Mm-hmm. Yeah. I mean, that was a huge reason why we're having this conversation in 2020 and not, 1980.
Yeah. Yeah. And so it sounds like it was permitted as an anesthetic for a period of time. And then it was also allowed as an option for veterinary medicine. During that, from the 60s until recently, was it ever used in the U.S. for therapy purposes specifically, or was that component of use of ketamine not allowed?
So what a lot of people have to understand is ketamine is utilized. So racemic ketamine hydrochloride is utilized to treat mood disorders and other, like central pain disorders as an off-label treatment. It's not directly FDA approved, meaning that the FDA has not measured the effectiveness on how well it works in treating those things. But when you use something off-label, there's been evidence to show clinical effectiveness to treat certain, disorders or illnesses, whatever you're prescribing to be utilized off-label. We use a lot of medications for off-label purposes. A really common one that I like to remind people of is, something that's used for anxiety, and it's actually it's a beta blocker that controls your heart rate. It just slows your heart rate down. It has nothing to do with, any neurotransmitter or your GABA or true anxiety relief. But if you can slow somebody's heart rate down, then you're going to decrease everything. So, it works indirectly and is very effective. And, that's kind of a really common one that's used frequently. And since it's a beta blocker for your heart, that, you know, the risk for abuse isn't there.
Yeah.
And that's the risk for abuse with the treatment modalities is what scares us away from utilizing them on a regular basis for, you know, clinical indications if they're off label, because not having that endorsement by the FDA allows people the opportunity to put, you know, the question in there, you know, is this really, you know, beneficial for that? Or is this, you know, some sort of, lucrative scheme to, you know, make me spend more money because it's not FDA approved, therefore it's not covered by insurance.
So just to clarify on that, if I'm understanding this correctly, so in the case of ketamine and with beta blocker medicines that you were just mentioning, it isn't necessarily that they have been, with the beta blocker example, which would be applicable to ketamine as well, that they've been thoroughly tested and approved for anxiety reduction. They have been investigated and approved for improvement of one's heart, but it is possible to take it because it's legal for heart treatment and also receive the anxiety reduction, which is sort of an after effect of its medically authorized purpose.
Yeah.
Is that fair?
Yeah. It's kind of just a blanket exception to use in, you know, other, courses of treatment modalities that aren't necessarily approved by the FDA.
Right. But because they're not approved by the FDA, like you mentioned, if I heard you correctly, they don't fall within the purview of what is typically covered by insurance.
Correct.
Okay.
Yeah.
So it all have to be, you can access it, but you'd have to pay for it out of pocket.
Absolutely.
Okay.
Yeah.
Gotcha.
Welcome to the American dream. This is the conundrum that we live in, because, there's the most recent thing that we've experienced with the ketamine industry is the recent approval of S-ketamine or Spravato. And the easiest way for me to explain the difference between regular racemic ketamine and S-ketamine is to compare it to cannabis. So you've got, if you look at marijuana, it's got CBD and THC. THC is your psychotropic component. And CBD is more of your anxiolytic, anti-inflammatory, so on and so forth. So with ketamine, you've got S-ketamine and R-ketamine. They're called enantiomers. 50% of the molecule is the S form and 50% is the R. Yeah. So the S-ketamine is what Johnson & Johnson has gotten FDA approval for, and that's what Spravato is. And the reason why it received a lot of praise was because it didn't have the psychotropic component. Although without that psychotropic component, you also get a huge reduction of its effectiveness. There's been limited studies for Spravato that have been endorsed by Johnson & Johnson and the pharmaceutical manufacturers of the medication. Although it's FDA approved, it's still very expensive, and it's still, although we typically say if it's FDA approved, then insurance companies are gonna, cover it. Well, yeah, insurance companies are going to cover it to a certain extent. They're only going to cover a certain amount over a certain time period. Yeah. And since it's so expensive, that does play a factor in how much they cover. Yeah. So, it's been really interesting to see, because in 2006 is when we started to realize that ketamine has the ability to be beneficial for mental health. And it took probably, we're still kind of in the growth phase for ketamine to truly catch on for mainstream. It's still considered alternative. And there's a lot of ignorance out there because the conversations aren't being had. It doesn't have the same, the kitchen table discussion that psilocybin and MDMA and LSD and stuff have, although it's increasing. It's been around, and it's kind of been the sleeping giant in the back that we're starting to realize, hey, we don't necessarily have to wait another 2 years for, these psilocybin trials to wrap up or whatever.
Yeah.
We've got something we can use now.
Yeah.
Although, the accessibility is limited due to the money and stuff like that. It's still something we can use. And to be honest with you, the patients that we've had that have tried Spravato have not had the same results with it. And it still comes out to be fairly expensive to get.
Yeah. And in your judgment, what would be the primary differences between the two in terms of the effect on the patient? What, if in your judgment there is any improvement that one could expect from getting, is it S-ketamine? S-ketamine. What would that be compared to what might be generally expected in a full R-ketamine, I think you said, treatment?
So, the antidepressant properties and the reduction of suicidality is significant.
Okay.
And FDA has approved Spravato for both of those. And just to piggyback on that, I would argue that it would be hard to say that racemic ketamine isn't effective at treating depression or suicidality because it's made of the same thing.
Yeah.
So it's just one of those in which, although it's not directly approved for it, it's still clinically effective. And the research is there. And S-ketamine research even validates that even further. R-ketamine, since it's got more psychotropic components, it's that experiential component that, part of our clinic that we seek out as well. And the therapeutic gains, because ketamine is going to have its natural biological effect on, your neuroplasticity and your ability to develop a new routine of thought and develop alternative ways to, troubleshoot and problem solve and see your reality from.
Yeah.
But that R-ketamine is the one that kind of helps give you that dissociative and mystical and, that psychedelic experience. So there's a whole spectrum of patients that we see that, if you are not comfortable with the dissociative experience and you don't like that psychedelic mystical experience, that's fine. We don't have to push the dose that high and for you to, completely dissociate. But we'll still get the benefits of, the ketamine on the brain and the, your whole, neuroplastic modifications. And that's something that we see with Spravato as well. It's just the additional benefit of the experience isn't part of the equation that you would get with racemic ketamine. And that's the reason why, when you're looking at getting treatment with racemic ketamine, no matter how it's introduced into your body, taking into consideration the external variables of where you're getting your treatment is significant, because those are going to play a factor in your experience. So, it's a bell curve for the patients that really benefit from, more of a higher dose mystical experience. Here recently, there's been some studies that have actually been able to correlate, the higher dose and the higher plasma levels with a more of a prolonged reduction of symptoms and a more significant reduction. Although, those are, haven't been peer reviewed and stuff like that. There's still some question of, if, although you'll get the normal, neuroplastic changes, no matter what the dose is, it may have a therapeutic benefit if you can get a pleasant experience out of it.
So we're sitting in your facility, and you mentioned this a little bit ago that there are people who are interested in this, and then there's also, it sounds like, a discrimination on your side in terms of who you think is either suited or capable of kind of handling the experience, or there's some sort of delineation or cutoff whereby, if I'm understanding you correctly, that you would not necessarily feel comfortable providing these treatment sessions to specific individuals with specific conditions or symptoms. I'd be interested in getting your judgment or thoughts on who those people are, and basically which type of people it would behoove them, or might be helpful for them to second guess their interest in getting the treatment. Like who in your mind is maybe not best suited for going through sessions like you offer here at the clinic?
That's an interesting question. So I actually think that, generally speaking, most everybody could benefit from ketamine.
Yeah.
Regardless of your prior experience with psychedelics, you just have to have a knowledgeable provider that, is aware of that and understands that component, not just from a professional perspective, but also it does help to have that direct experience from a provider's aspect, because it would be very hard to explain to you what the experience is going to be like and to prepare you adequately to have that experience without truly understanding what that experience consists of. Mm-hmm. Because it's such an abstract experience. There's hardly very many words in the Webster's Dictionary that can describe it fully for someone to understand that. So, we ask a lot of questions, and, we go off a person's medical history, their past social history. If they've tried psychedelics in the past, or even marijuana in the past, what type of reaction did you have? Well, what type of environment were you in? Were you 18 years old at a party when, you smoked marijuana and got paranoid and had a bad experience? Or was it, one of those in which, you tried it out and it was, for all, intents and purposes, you tried your best to make the set and the setting the best possible, and you still had an adverse experience.
Yeah.
So just kind of knowing the full story behind one's experiences in the past will give you a very good idea on how they're going to respond to a ketamine infusion, or ketamine therapy just in general. But the big disqualifiers are typically medical reasons. If someone's got extensive cardiac history, or if they've got some sort of kidney impairment or liver impairment that's going to affect the metabolism of the medication. Or something of that nature. Those are the big things. The most common side effects that we see with ketamine therapy is an increase of heart rate and blood pressure. So if you've got uncontrolled hypertension, you've got to get that under control before you're considered, a viable candidate for the treatment. But when it comes to an individual's past experiences with, psychedelics in general, even if someone, relays to me that they've had, negative experiences in the past, if we just approach their treatment a little more conservatively, at a lower dose, and really emphasize the preparation and getting them into the right mindset before their treatment. We really don't have that many, I would say, negative experiences.
Mm-hmm.
I like to use the frequency that we utilize a Versed or benzodiazepine to calm someone down during treatment. And we don't utilize it very often. And part of the reason for not using it is because it will impact the experience. It does have certain properties on your memory that cause, some amnesia. So ketamine experience is it's kind of like a lucid dream. And once you get done with that experience, the memories are like a dream. They do, kind of have difficulty being recalled the longer out from, the experience. And if you're able to sit there and, provide a pleasant experience for somebody who might be scared or extremely, anxious about what the treatment involves, man, that can kind of, just smooth out the road for that person that's going to change the rest of their life.
So if, let's say, somebody walks in here and they're interested in this, and they're, for lack of a better phrase, a normal person. They have periodic, days or moments of anxiety, depression, but nothing clinical that it's so extreme or debilitating that they're not a functional member of society. Would you welcome them to, if they were inclined and interested in having this experience, to do so? Or are you really more inclined to welcome in people who are dealing with serious trauma, serious mental illness? What's kind of your take or judgment on that?
So it's a slippery slope. And since the field of ketamine is highly unregulated right now, it's best practice, since it's being used off-label, to ensure that you've got the qualifiers there for indications for treatment. Mm-hmm. So it is starting to be used more earlier with depression. Some psychiatrists are comfortable recommending patients do ketamine therapy, after one failed medication, as opposed to waiting until the patient fails 2 medications, because that's the definition of being treatment resistant, is that you've had to have failed, 2 trials of medications before. And if, the course of 2 other antidepressants didn't work, then you've got treatment resistant depression.
Yeah.
To be honest, whenever it comes to, a clinical diagnosis for, generalized anxiety disorder, it's a very broad category. And right now, especially like in the pandemic, even if you don't think that you've got generalized anxiety disorder, most of us are experiencing a generalized anxiety disorder right now. So although it's not clinically something that you've went to a psychiatrist for, I'm not going to sit there and say that a ketamine infusion is not going to be therapeutic for you. Mm-hmm. And of course, that we do have to have that clinical indication in order to administer treatment. To check all the boxes for the medical board and regulatory indications. But it's also one of those that if you think that you may have depression or anxiety or PTSD that's not necessarily, has been diagnosed, or, it's not significantly impairing your, daily living, that shouldn't be the indicator on whether the treatment would be beneficial for you or not.
Yeah.
So, if someone comes and presents and they do have those that may not have been diagnosed, then we will ask for them to get, a diagnosis from, their psychiatrist or whomever. But since it's utilized in an off-label purpose that's not covered by insurance, direct referrals from one's provider are not typically necessary in order to receive ketamine therapy.
Okay. So it might, in principle, it could be possible for people who do describe themselves as you just articulated to be able to come in, provided they can afford it, and have treatment here without the bureaucracy of a formal instruction from a doctor or a psychiatrist. Is that fair?
So one of the things that we have the convenience of is the doctor that we have on our team is a psychiatrist.
Okay.
So it does provide us a little bit more freedom to deal with patients that do not have that formal diagnosis. But, the other two common physicians that are involved with ketamine clinics are emergency room doctors and anesthesiologists. Yeah. And, it's really up to the medical doctor involved with that practice on what they're comfortable with and what they require from their patients in order to qualify to receive treatment.
Okay.
So if there's a patient that, there's question about whether there's a formal diagnosis, at least for us, it's very easy for us to get our supervising physician involved in order to get that, medical clearance and that check.
Okay.
If for nothing else, it's just best practice.
Okay. So by the letter of the law, it sounds like that may not be necessary, but in your clinic specifically, and I would imagine in most clinics, for best practices, as you just articulated, that is sort of a step along the way prior to treatment.
Yeah. Okay. I mean, the big part is, ketamine, you don't want to be naive about it. If it is available to be abused, people will abuse it. Yeah. So, we want to encourage the utilization of psychedelics for this purpose in a very, legitimate, reasonable fashion. And, we don't want, whether it's our clinic or other clinics, we want to try to refrain from, kind of watering down the market and getting a bad rap before we even make it back into mainstream acceptance. Yeah. Because, most people, the first thing when they hear the word ketamine is Special K or recreation. And so when you've got that stigma that's associated with it, for the industry and, for society in general, it's best to fall on those best practices because all the naysayers and the people that don't necessarily endorse psychedelics for the treatment of mental health, you take that component out of the mix, and it makes it a lot more legitimate. And regulations are going to come. It's a matter of time. And if we can figure out how to regulate ourselves, it's going to make things a whole lot easier for us in the future.
For sure. In your experience, it sounds like you have been involved in this line of work for quite some time now. And you mentioned that there periodically people, their heart rate goes up. They do have, troubling or difficult experiences while on ketamine. I'd be interested to have you speak to that what, when I think one of the fears in society is taking psychedelics and truly like permanently breaking from reality, becoming permanently psychotic and not being able to re-enter normal reality again, essentially losing your mind.
Right.
in your years of work in ketamine specific therapy, have you ever seen that? And generally, what I would love to hear you just speak to those fears and what you think is a legitimate concern from society at large, and what you think some of the misconceptions are of what can happen to people when they go through these experiences.
Yeah. So, psychedelics in general, if it's given in a controlled setting that you're able to, regulate all of the variables, then to my knowledge, there hasn't really been, a clinical case of someone not being able to come back to reality. Since that experience is so subjective, it really comes down to the interview and what was, their functioning and baseline prior to the experience. One of the big ones that I like to remind people of is, electroconvulsive therapy, ECT. It's still an approved treatment for, extremely refractory depression. But that legitimately has cognitive impairment because you are pretty much electrocuting your brain. I mean, legitimately that's what it is. And there is plenty of clinical studies that show significant cognitive impairment after treatment. So, whenever it comes to utilizing things like TMS, it's transmagnetic stimulation and different type of, theta burst therapy and psychedelics, including ketamine. The risk for cognitive impairment and prolonged, kind of not coming back to reality, isn't a concern. I mean, we have been practicing ketamine therapy for almost, 2.5 years now, and we're getting up to around 2,500, infusions that we've administered. And out of 2,500 infusions, I've never had somebody who's had, any type of cognitive impairment or adverse impact neurologically. Yeah. Most of the time, if you're able to get the person to hear the words that you're able to speak to them during the experience when they're having those moments of anxiety and, I like to use the phrase, you get a little far away from your tether to reality and it becomes a little uncomfortable. Just having somebody, put their hand on your arm and be like, you're doing fine. Everything's okay. You're completely safe. That provides that reassurance that strange, confusing, weird experience that you're in, it's okay.
Yeah.
And if it's only for a specific time period, that also helps provide you the reassurance on having a comfortable journey as well.
Yeah.
And that's the nice thing about doing ketamine therapy with an IV. I can set a timer, and most patients, generally speaking, will recover at least 90% of their mental faculties within 10 to 15 minutes after the end of an infusion.
Yeah.
And, the half-life of ketamine is extremely nice. Typically within 45 minutes after the end of treatment, you've got, I'd say anywhere 95 to 98% of your faculties back. And depending on your metabolism, 2.5 to 4 hours is how long, the half-life is. Wow. So it's much that's the nicer thing about it, as opposed to psilocybin or LSD right now, is that, we know what types of effects we're going to elicit at certain dose ranges. So we start everybody off at a weight-based dose so we can get a good, accurate measure of their baseline and what they're comfortable with and how they're going to respond. And since it is a series of 6 over a 2 to 3 week period for the initial mental health induction, that gives us the opportunity to graduate their dosing throughout that course of treatment.
Yeah.
And what we're shooting for is to get, a slight improvement from each treatment and be able to stack those and compound those benefits. And that's what helps the sustainability for the prolonged results that we're seeking, because, we don't sell lemonade. It's expensive.
Yeah.
So we want to try to elicit the longest duration of benefit, as well as, the most significant we can achieve.
Mm-hmm. You mentioned earlier that there just aren't words in the dictionary to describe what these kind of mystical experiences can be like. Granting that, I would love to get your take on maybe some you're welcome to speak as specifically as you would like, but general themes of what you notice people tend to visualize, contemplate, changes that you've noticed in people who have gone through these experiences. Just any sense you can try as best you can to illuminate what it's like to go through an experience like this, especially for somebody who has never had a psychedelic experience in their life.
Yeah. I mean, it's kind of funny because when you're speaking to somebody that's typically a little older, they don't have as much familiarity with psychedelics as someone who's younger. It's just generational.
Yeah.
So you do have to be cognizant of that and be able to try to be creative with your descriptions. And, like I was talking about earlier, that direct experience is what, gives us the benefit on being able to convey that to patients. We try, each member of our team has an experiential infusion, so they know what it's like. Because when you have a provider doing this type of therapy who truly cannot relate to it 100%, it just provides a little bit of disconnect. And, there's always that gap of communication. People who have experienced similar things, even if they can't convey it in words, they can still have that related, shared experience and be able to communicate that even in a nonverbal context. So, and that's extremely important. But, typically when a person comes in for their first treatment, we go through a process of trying to ensure that everything, as far as the Q&A and the preparation has adequately been done. And that way, when we're in the room, we're not having to, go over a review of actually what you're going to experience. But I will remind patients, once we start the pump, it takes about, 7 to 10 minutes, and you get that warm blanket effect. It's kind of, an intoxication from having a couple drinks, alcohol drinks.
Yeah.
You do have that degree of the intoxication. Sometimes patients may feel like a rolling sensation underneath their back or butt while they're laying in the chair. And although the chairs are massagers, we don't use it during an infusion. It could be a little over the top, but it does, it does give you that physical sensation, the ketamine, like you're getting, a roller underneath your back. And, as the infusion goes on, part of ketamine being that, anesthetic, it does cause, a little bit of numbness and tingling to smaller blood vessels. So your hands and your feet and around your lips, they get a little numb, kind of like you've had Novocaine or something like that. And, you'll get a little bit of cotton mouth, and it's just, you feel like your limbs are gone. They disappear. But, I promise they're still attached. Once the ketamine starts to wear off, you'll start to feel them again. But that's part of the level of dissociation. It's one of those that you can, dissociation is, it's a very broad term. Just because I say, did you dissociate? I mean, even at the smallest dose, if you have some sort of disconnect between your hand and brain, that's dissociating. But what typically people are asking you is if you completely checked out of reality and had, an experience outside of the room, that you lost the ability for to have that recognition that you were present in the room, and it typically is precipitated by the loss of your peripheral vision, and you kind of get tunnel vision on whatever you're focusing at. One of the observational clues that you can use is looking at someone's eyes, because psychedelics actually cause vertical nystagmus of your eyes. And that's one of the big reasons that you get distortion to your visual field, is because it causes the nystagmus. But psychedelics are very distinct in that form, as opposed to other like alcohol will cause horizontal nystagmus. So when, if you're watching somebody else who's, having a psychedelic experience, when you start to see, their eyes kind of do jumping jacks, you can, correlate that to a fairly, dissociative experience. It doesn't have any measure of the pleasantry, but you can, have an idea of where the patient is mentally by, just kind of looking at their eyes. And you'll also see, the more somebody dissociates, you'll see a little bit more elevation in their heart rate and blood pressure. I like to refer to it as a mental marathon. Although you're sitting in a chair the entire hour and not moving, the ketamine is, causing your mind to do a mental marathon. And the big part of why ketamine really helps with mood disorders in general is because it shuts down that default mode network and allows the message between your amygdala and frontal lobe to communicate more effectively on what you truly need to communicate back and forth. We're excellent at having, that excessive negative chatter in the back of our brains, minds when we're thinking. And that has a lot of impact on our ability to break out of, a rumination or that loop. It's interrupting that loop is where the perspective shift and that, the therapeutic gains are made. Because when you're stuck in that routine of thought and that, that constant self-negative chatter, honestly, I've never experienced any other medicine or seen any other medicine as effective as ketamine at interrupting that loop. And to put it in like 1, 2, and 3 on the mood disorders that I think that, its effectiveness is, I would say suicidality, acute suicidality, it's extremely effective for. As a matter of fact, the Department of Defense and the VA has actually endorsed ketamine infusion therapy as a first-line treatment for veterans actively or experiencing active suicidal ideations. Although that was released in, just an opinion statement, and it's not truly being put to practice. It's pretty significant whenever you have, the VA say, hey, although it's not, quote, FDA approved, we've seen the benefit work really well for suicidality, and we recommend it being used as, one of the first line treatment modalities. And we see it even in non-vets. Part of our goal here is to make, ketamine therapy more accessible. And we do try our best to do as much outreach as we can by offering certain, discounts for vets, first responders, and being in Austin, local artists and musicians. That's a huge population that we have here in Austin. And like Ham is a fantastic, personification of, Austin and its music, and mental health is, it doesn't pick and choose who it impacts. And, a lot of artists and musicians typically have higher incidence of mental health illness, as well as first responders and vets with PTSD and stuff. So that's been really nice.
So if I heard you correctly, it's shutting down the default mode network of the brain to allow the frontal lobe and the amygdala to have better communication with each other. Subjectively, for individuals that are in the middle of having that effect on their brain through the ketamine infusion, as a subjective experience, is that immediately noticeable? And regardless, is it visions of their past that people tend to see and be able to work through more effectively? Is it just insights on problems in their lives that they ordinarily were unable to sort of reason through or think through? What is that improved communication between the frontal lobe and the amygdala actually feel like for the people, if it can be put into words at all, for patients that are in the middle of that experience?
Typically, so I recommend that you don't go into any psychedelic experience with a specific intention.
Gotcha.
On trying to work through one thing. Yeah. Ketamine, like most other psychedelics, your mind is going to go wherever your mind is going to go. Just going into it with a positive mind frame is the kind of the most important concept of going into a ketamine infusion with. I use the phrase, if you're about to go play a football game or a baseball game and you're not giving yourself the opportunity to win that game before you even hit the field, I'm going to say the probability of you winning that game is extremely slim to none. Yeah. So just having the openness and, the will and the want, and maintaining some degree of hope that this is going to work. I'm going to benefit from this. And just putting those positive intentions in place before the experience, and trying to be open as much as possible to the experience is going to make that experience much more pleasant. And, typically the most frequent response I get from first-time patients who, whether they've had experience with psychedelics in the past or not, is, my God, that was so nice. Everybody should do this because we all have a backpack of bullshit, pardon my French, but we do, and it's unique to each one of us, our experiences, our traumas, our depressions, our anxieties. I mean, it all weighs differently. It smells differently, carries differently, and, it interferes with our lives to different degrees. But we all have one. And if you can take that backpack of BS off before you go into that experience and just be open to welcoming the experience and leaning into it and just being like, okay, I know it's going to be weird and confusing just for a short period of time, but I'm going to be fine afterwards. I'm being taken care of. Somebody's watching over me. I don't have to worry about, my medical safety and well-being. The more you're able to let go and just be in the moment and to roll with it, the more pleasant that experience is going to be. Part of, having a ketamine guide in the room with you, all of our ketamine guides that sit in the room with you are at least paramedics. So you're never going to have a lower degree of medical care than a paramedic at our clinic. Unfortunately, that's not the same at every clinic. Not everybody provides a guide with you. Not everybody, does the same protocol over 60 minutes like we do. There's a lot of different strategies on dosing and length of time and delivery routes, but no matter where or how you get your ketamine, it still is a psychedelic, and it's going to elicit some of the same types of experiential components.
Yeah.
So, as a blanket statement across the board with ketamine therapy, the more you're able to just let go and be in the moment, the more pleasant that experience is going to be. And having somebody in the room that can provide you with a little bit of grounding from moment to moment can, truly make or break that experience, whether, you get stuck in a negative moment or feel trapped or have, that really high anxiety develop. Project Zendo with MAPS describes harm reduction. And if, you can kind of use the same philosophy that they use for, facilitating, psychedelic experiences in a recreational setting for a clinical setting. And it, harm reduction and trying to help facilitate a good experience, but not control it.
Yeah.
You don't want to try to direct someone's thoughts or try to, get them through it. Even with moments of, we'll have a patient look at us with, the deer in the headlights look that's just like, oh my God, this is just outrageous. And, you kind of get that unsettled feeling that, maybe they're not having a good experience. And then, you've got a little bit of reservation after it's all over, when you ask them, so how was that, and, generally speaking, a lot of the time patient reports, man, that was excellent. They don't necessarily remember that really anxiety provoking moment if they were able to lean into it and just kind of roll with it, because it's going to pass. It'll pass shortly. You're not going to be on one thought for very long when it comes to ketamine. And typically, as the dose escalates, the speed at which you move through your thoughts is reduced. So the higher the dose, the faster you flip through that book. So, and that's what can cause a person to have a too intense experience, is that it just gets a little too chaotic and a little too confusing for their comfort level. That's the reason why it's very individualized. Sometimes, it's like fishing. You cast your rod out there and, you can undershoot and you can overshoot, but we're always aiming for that sweet spot
Yeah.
where we're really able to identify a pleasant experience, but also escalate the dose as much as possible where it's safe in order to get the highest therapeutic gain.
Yeah. And in the middle of that experience, you just mentioned someone saying like, wow, that was ridiculous. For somebody who's in the middle of a ketamine trip or therapy session, experientially as that individual, like subjectively, will they still know that you're in the room and that there is someone to talk to if they do experience some anxiety? Is there still a connection between, for lack of a better phrase, the world you and I are inhabiting right now and the world that someone who's going through that kind of a psychedelic experience is experiencing? Or is that basically cut off?
Well, it depends on how dissociated they are.
Yeah.
And the goal with ketamine therapy is, to do sub anesthetic level dosing for ketamine.
I see.
And that really, that's kind of the, that black and white line.
Yeah.
When you're starting to look at dosing, because, at least the way Texas has it set up, you can't give a bolus of ketamine in an outpatient setting like we're in. Mm-hmm. And a bolus is just like let's say I start an IV and I give you, 100 milligrams of ketamine all at once.
Yeah.
That's a bolus. Since we titrate it over an infusion over a specific period of time, that's the delineation between the two. In Texas, if you give boluses of ketamine, you have to be an office-based anesthesia practice. You can't be an outpatient medical clinic. So it's just that degree of the regulatory issues for medical settings. Okay. But typically with the dose, if you're still on, what's referred to as a low dose for outpatient ketamine treatment, the person's not going to be completely dissociated. We are wanting to achieve a level of dissociation where you're still able to engage with me with verbal stimuli. Yeah. If we get to the point that, although that engagement may be a thumbs up because you can't speak, because your language processing center gets impacted significantly by ketamine, still I'm able to elicit some sort of response by, engaging with you verbally. Mm. If I have to arouse you by a painful stimuli, then that's where we need to start backing off on the dose because we're getting too high. Yeah. That's starting to get, out of the sub anesthetic level dosing. But even with certain patients, at, sub anesthetic levels that are moderate or moderate to high, they may require a little bit more verbal stimuli in order to engage them. And, whether it's not something that you're cognitive about during the experience because you're not really going to remember it, generally speaking, unless it was a really significant moment that kind of shook you to your core. But, if it's one of those in which let's say I see your heart rate go up and it starts to hang out at a pretty significant level that would indicate that you're not having, a very easygoing experience. Yeah. Just putting my, hand on your shoulder and giving you that verbal reassurance can typically help, kick you out of that space. And it does cause a little bit of grounding, although you may not be completely aware of it at the moment. It does bring you out of that moment, that experience, and kind of bring you back to reality just a little bit, but it's completely subjective on, to what extent it does that for individuals.
Yeah.
Part of the experience that patients need to understand is, you don't have to keep your eyes open to watch the video. You don't have to listen to the music. You don't have to, speak. You don't have to engage with the person. The idea is to do whatever you feel most comfortable with, because this is your experience.
Yeah.
And we want to provide the support necessary for you to have the most positive and pleasant experience. And, the patient's always captaining the ship. We're not going to, lock you into any treatment that, you're uncomfortable with, because if you're not uncomfortable with it, you're not going to have a pleasant experience.
Yeah.
So, and, once again, you fall back to the cost of something. The more something costs, the higher that level of service is expected. And, you want to be able to provide as much safety measures for one to be able to check out and have that mystical experience, if so that's what they choose and that's what they're desiring.
So if somebody comes in here and they have a wonderful experience, and it sounds like the vast majority, if not basically everyone, has said that after they have left. And I think in general, am I right that the sessions it's generally 6 sessions over the course of a couple weeks or a few weeks? Is that typically the duration of how long the sessions take?
Yeah. This goes back to the original NIH, trial they did early on. That was something that they tried and showed that a serial set of treatments is where they saw the clinical effectiveness. I will say, because one of the things that we are very cognizant of here is people's schedules. We have a very, a unique schedule for a medical clinic. We open at noon, we close at 8, and we're open Monday through Saturday. So, if you're working a 9-to-5 job, you can still come in and get treatment and still continue your day job and not have to take off. And when you start having to, the more things you have to do to move your life around to get this treatment, the more hurdles that, and the more difficulty one has to get the treatment. And that's what we're trying to do is, take those hurdles and those blocks for the access out of the equation. So one of the most important considerations when you're looking at, how often should I have a ketamine treatment, has a lot to do with, well, what did your last treatment consist of? What did you walk away from that treatment with? Was it something that, just kind of, really taxed you physically? Do you need more time to recover from the physical, quote, hangover? Sometimes you can get a headache from it, or, you may feel a little bit of physical, drain the next day. It's not very common, but sometimes that's a consideration with patients whenever, they're looking at scheduling it. In a general aspect, we do encourage it over a 2 to 3 week period, because as long as we don't get a backlog on processing, then typically the closer you can get those treatments, the more of a compound result you can end up with at the end. One of the big things that's really evolved over the past couple of years is the necessary component of integration with psychotherapy. It doesn't necessarily have to be a psychotherapist, but some sort of therapist, because when you come in and have those experiences, sometimes you don't really know how to navigate or process or, deal with the actual experience that you went through, and you may need a little bit of professional guidance or navigation in order to process those experiences. So we want to ensure we're putting enough time between treatments to allow for enough mental recovery and physical recovery, but also try to get them in as close as possible. And typically we've found that 2 to 3 days between treatments is the most common. And also a lot of different clinics have different theories on, the ketamine assisted psychotherapy. And that's having a psychotherapist in the room with you while you're having the experience. That can be extremely beneficial for some patients. We've also found that we've gotten extremely beneficial results with patients following up with their therapist within 24 to 48 hours after they receive treatment.
Yeah.
Obviously, the closer you can get that therapy to your treatment, the more malleable and the more open and neuroplastic your brain's going to be to process and, have adequate time in order to make all the changes necessary. But we don't necessarily see a added benefit, especially when it comes financially, by having somebody, a psychotherapist, in the room during the actual time of treatment, especially for patients that are, in a moderate to high dose where they're dissociated for, most of the 60 minutes.
Yeah.
Otherwise, you're pretty much paying that therapist to sit there for 45 minutes and stare at you. So, it's just one of those in which, it really depends on whether, how you're getting the ketamine, how much dissociation, what type of experience, you're eliciting at the time, on whether you should have the therapist in the room during the time of the therapy, or whether it's still advantageous to follow up with them, whether it's in clinic or you're going somewhere else and seeing your therapist.
Yeah.
One of the main reasons why we picked the location that we're in is because this complex has anywhere from like 30 to 40 therapists and counselors and social workers within the same area. So there's a ton of different businesses around us. And if you don't have to drive to go see your therapist after your ketamine infusion, it makes it kind of convenient because you can just walk literally right across the parking lot and go see your therapist and have your session 45 minutes after your treatment's over.
Yeah. How about for people that have really enjoyed it or gotten a lot out of the experience? Do you ever see people coming back for, let's say they go through a 2 to 3 week session, 6 sessions in total, a time period after that, whether it's months or a year or so, they're interested in doing it again. Is that something that your clinic is okay administering? And is that something that you do see from patients? And if you do, what is is there a recommended sort of a distance between that 2 to 3 weeks, 6 times session and the next one that you would think is a reasonable time has elapsed for the next session to take place? Yeah,
so it's absolutely part of it. It's just a maintenance, and we commonly refer to it as a booster infusion, although it's not necessarily a booster. It's a maintenance infusion to help with the symptom reduction over time. And this is extremely important for patients that have a history of PTSD. And I'm speaking directly from experience. I've been, doing ketamine therapy for the past couple of years. Most paramedics that have been paramedics for 20 years, they've got PTSD. And you do need a routine maintenance program. The biggest protocol that's commonly used by a lot of clinics is on a 4 to 6 week basis where you need to come back in for at least a single infusion, a single treatment. One of the unique things that we utilize here that isn't commonly practiced, at least not in Austin and not routinely within the state, is we use an app that actually tracks our mood or the patient's mood on a daily basis. And, it's something that allows us to put an objective metric on how you're doing outside of the clinic. Because one of the, risk associated with getting cash pay treatment is profiteering. And when it's extremely subjective, sometimes people can be influenced on how many, appointments they have that month. If, you've got a week and, you need to fill up your schedule, then sometimes that can influence a provider's discretion on recommendations on how often someone should follow up for that maintenance treatment. So the more objective you can be about analyzing someone's trend and how they're doing with that recommendation is extremely nice. And it also provides a little bit of reassurance for the patient as well, because what we use, the patient can go on and look how they're trending and how their mood has been. And there's different things that if we start to see a patient trend down, we can send them new mental health questionnaires, and ask them, and if it, there's a certain threshold where if it drops below a certain level or a certain number with a patient's report, it will automatically generate another questionnaire or email or an alert to us. So we'll know about it. It measures, it's pretty simple. It's just a text that you get. It measures, how's your mood? 1 to 10, and 10 being the best. If for some reason, you've been at an 8 for 3 weeks and all of a sudden you start trending at a 2 for 4 to 5 days, that would be cause for concern that we may want to reach back out and be like, hey, what's going on? Yeah. Just, notice. And that provides that objective metric. And we're always going to sit there and tell patients, it's better for you to come in sooner rather than later, because especially with mental health, we typically put it off so long that we end up putting ourselves almost back to the same spot we were at before we got treatment to begin with. And we don't want to lose all that momentum and all those gains that you got from your initial mental health series. Yeah. Sometimes patients that respond extremely well can put it out, to 3 months or 6 months. It's not as common, putting it off that long. Most people do need that more regular 4 to 6 week maintenance schedule to maintain their symptom reduction. One of the things that we do here is we do outpatient prescription therapy with ketamine. And that's where we write you a prescription for compounded ketamine that we get from, the pharmacy that we work with and have been working with for the past couple of years. And you take that on a regular basis in order to keep the ketamine in your brain and keep those neuroplastic changes. And most importantly, that makes ketamine unique from other psychedelics is it works on your glutamate neurotransmitter. Most other psychedelics are working on your other neurotransmitters, whether it's, serotonin or your norepinephrine, stuff like that. Most psychedelics hit all of them at some degree. But with ketamine, it's the glutamate. And that's really been the game changer with ketamine and mood disorders and the treatment is learning a new neurotransmitter that we can control that has profound effects on one's mental health. So, I mean, it really is that this is going to be a whole new field for, pharmacology. Unfortunately, with big pharma, that also means a lot more patents and a lot more money. But, the more research we can get, regardless of, whether it's big pharma or not, hopefully the more people we can help with the different pharmacology. And I will say on that note, whenever it comes to looking at the way psychedelics work, if anyone is considering, taking something to help potentiate the therapeutic benefit of psychedelics, especially with ketamine, I would definitely encourage them to take a magnesium supplement on a regular basis, because we're pretty mag deficient in our diets, and magnesium is critical for your central nervous system. And if although you may not be deficient to the point that you need that daily supplement, it's definitely not a bad idea to take a supplement, as long as you don't have any contraindication for it, in order to ensure that you've got enough magnesium there to make those neuroplastic changes and have those neurotransmitter improvements that we're seeking. So that's one of the big topics that I like to remind patients of, because it's probably the most underemphasized component of the psychedelic therapy is the electrolytes. I mean, you got to make sure your body's healthy in order to have that mental health gain, because we're one big organism and everything ties into each other.
Do you ever find that patients come back, a year or more later and are interested in doing the full, 2 to 3 week session again? And if so, is that something that your clinic and other clinics are generally open to doing, or is it really kind of once a lifetime you go through that 2 to 3 week 6 session process? No,
I mean, it's I don't think any clinic is going to turn you away if you want to repeat your series.
Okay.
Obviously, we want to recommend it, the responsible use of it. And if we think that a patient may be coming in a little too frequently, or they're, having a little bit too much recreational fun out of it, as opposed to, a medical need, then that might be, a factor in our recommendation on how frequent.
Yeah.
But, one of the things that we did during the pandemic, when things first, started to evolve, the National Ketamine Association put out an opinion paper, and it was also endorsed by many others, regarding ketamine infusion therapy, or just ketamine therapy in general during the pandemic. And it was an essential service, because that was the big thing. Although it's, outpatient and it's, voluntary and it's elective, especially with this pandemic and the mental health toll that it's had, this has become an essential service for a lot of people. And we even started to, try to run like payment packages and financial packages for patients to come in more frequently, because, they were seeing that the results that they had gained were waning much faster.
Yeah.
And that is one of the things that I mean, no matter what medicine it is, the more stress you've got and the more, life stressors you have go on, the more of that, positive therapeutic effect is going to wane much quicker. So, and ketamine's the same way. If, you're living on an island somewhere and you've got no stress in life, your ketamine is going to last a pretty long time. But if you live in the same world that we do, typically, it can wane much quicker. And during the pandemic, we've seen those that patients actually, have the ones that were coming in like every 4 to 5 weeks had to bump up their schedule where it was every 2 to 3 weeks.
Yeah.
And, we didn't lose sight of that. And we try our best to accommodate that increase of demand. And that's one of the reasons why, because when we first opened, we didn't have the first or the second room set up. We were running one room. That was how our business model was created. We didn't need it. It wasn't necessary. And then, with the initial stages of the pandemic, it was, kind of nice because we were only running one room and seeing, 4 patients a day.
Yeah.
And, things kind of ticked up and surge and volume picked up for not just us, just the industry in general. And, we put on the second room. That way we could bring in 2 more patients a day and still, do the socially distance thing. And it's been nice that we've been able to accommodate that, but it's also been a sobering reality that that's something that we've had to accommodate for, that people aren't doing as well. But I think that's, just one of the realities of the way, things have evolved where we're at right now is, at least for a little while, we're going to have to be a little bit nicer to ourselves, and we may have to spend a little bit more time and care on our own mental health for, at least the next year or so until we have some sort of idea of, where we're headed.
It does seem like psychedelics in the culture is in a growth phase of just in conversation and in potential use for all sorts of psychological ailments that people might be going through in their life. What in your mind, what are the main differences and similarities between ketamine and the other maybe better known psychedelics like psilocybin mushrooms and MDMA? How do you compare and contrast the experiences and the efficacy of those drugs in your mind as the same and different?
So whenever it comes to, just psychedelics in general, ketamine truly isn't, it's an uncommon experience for someone to have a true hallucination.
Huh.
It's typically a distortion of what's actually in your visual field that's being emphasized. Or if you close your eyes, you can see things in your eyelids, just by having your eyes closed, and they're just figments of your imagination. It's not like a true visual hallucination that you're having, that you would have more so with like LSD.
Okay.
But, it's a distortion of the reality, and, all of your senses are heightened, your vision, your hearing, things just, everything is distorted. And that's where you get, almost, that enhancement of all of your senses, as opposed to, a complete fabrication of something. And, whether we're talking about ketamine, MDMA, mushrooms, LSD, DMT, ayahuasca, we can go all over the board. All of them are going to elicit a different type of experience. They are going to attract a different type of person. So just like the dosing for ketamine is individualized, the psychedelic experience for one is definitely different from each experience. From the, clinical trials that we've seen so far with the MDMA and psilocybin, and even with ketamine, we've seen the effectiveness for PTSD with MDMA and psilocybin more so than ketamine, as opposed to with depression. So it may be more clinically appropriate depending on what mood disorder you're trying to alleviate. Maybe why you would choose one over the other. Mm-hmm.
Another. Just to stop you there. So which of those substances would you say is most effective for depression, for PTSD? Which maybe they're roughly the same, but in your mind, how do they compare to those specific ailments?
So I think that the science supports MDMA and psilocybin more for the management of PTSD. Okay. I think it's had a little bit more clinical effectiveness on managing PTSD as opposed to depression. Okay. Ketamine has been extremely beneficial for depression as opposed to PTSD. Do the substances work on both disorders? Absolutely. Okay. I just think that, if your primary issue, most patients with one typically have issues with the other. Right. I mean, they come in pairs and sometimes all three present. So, if you're struggling with PTSD predominantly, right now, the clinical research is showing a little bit more hope in MDMA being a little bit more effective than ketamine. And, the trials with psilocybin, have represent some of the same literature as well. When it comes to dosing is the big part, because with psilocybin and LSD not being even approved for off-label treatment for anything.
And explain what that means, not being approved for off-label.
So the different schedule categories for controlled substances. If it's a Schedule 1 drug, it doesn't even have research potential. We can't even investigate it. So that's been the big change especially with psilocybin and, psychedelics in general that has evolved, is the fact that we kind of cracked the egg, and we have now convinced the powers that be that there is some sort of research viability in these chemicals and in these substances, and we should investigate them further.
They had been in a Category 1, which barred all research, and have somewhat recently been shifted to is that Schedule 2 or Level 2 drugs. Yeah. Well, what is a Level 1 substance to this day that is off limits to research and investigation?
Let's see. So,
is that like meth?
Heroin?
Yeah. Okay.
Heroin, methamphetamines.
Yeah. Okay.
So typically, cocaine falls into that category, but they still use liquid cocaine for nasal surgeries. Okay. I mean, it still has a medical approved
application. Yeah.
But ketamine. The funny part about ketamine is it's been FDA approved for so long. It's actually not in the same schedule category as, most of the other like opiates and commonly, medically approved, abused substances are. Although it has been, used for recreational and abuse in the past, it's just that the safety profile with it is so high that even if it is abused, it doesn't fall into as a severe category as schedule.
I think you were saying that one of the things, you can correct me if I'm wrong, that about ketamine is the ability to control the dosages, whereas with you were beginning to talk about psilocybin and MDMA and sort of some of the differences between them. Is that one of the primary differences right now, that like with ketamine, it is such a precise application and injection that exactly how much you're giving to a patient, whereas it's a little bit harder with some other substances, or is that not necessarily the case?
Yeah, I mean that really is kind of the heart of the matter.
Okay.
And that's what we're trying to figure out, is exactly how can we take, this naturally growing substance and, start to measure its properties, and, how can we, either cultivate it or synthesize it to, a purity, to a point in which we know exactly, what chemicals we have and exactly what strength and what type of reaction they're going to elicit.
Right.
That's the big problem with recreational drugs, period, is
Right.
just not knowing the potency, the purity, the dose, whether it's, you're doing ayahuasca or DMT or mushrooms or any of those. It's just not many of us have, a mass spec in our garage where we can just go, test the, solution of something and check it out. And that's the really big thing. And, some of the other psychedelics really cause, a significant, impact on like your serotonin system. So if you're on, a antidepressant that may be a SSRI, and let's typically with, LSD and psilocybin, they hit more your serotonin. You could actually have serotonin syndrome and, have adverse effects from that. That's one of the reasons why a lot of the ayahuasca retreats that people hear about, ask you to go through, a cleanse process. But whenever it comes to, antidepressants or other medications for mental issues, we don't recommend changing any medications or typically much during your initial treatment, so we can minimize the variables, so we can kind of hone in on exactly, what is the ketamine, what we're getting is from our actions, our direct actions, and it's not from, a dose change on another medication or, an interaction between, illicit substance and ketamine. There's been, a mixed bag of results with, cannabis use during ketamine therapy on whether, it's kind of engaging the same systems or, whether it has a counterproductive effect. And I think it's just way too early right now in the research for us to sit there and say, objectively one way or the other. But if you go ask a medical professional, if they recommend you to use something that isn't legal, they're going to say no, period. I mean, that's just the CYA answer. I'm not going to recommend for you to go do something that's not legal. And if you've got to come off of your other medications in order to do it, I would highly recommend that you do it under the guidance of somebody that knows a little bit about those medications. Whether they're endorsing what you're doing or not, at least have, a physician kind of give you a little bit of guidance on how you should handle your medications, as opposed to just reading it off of Reddit.
Is the experience of a ketamine therapy session or trip, would you say it is comparable in its experience, the nature of the experience itself, to a psilocybin mushroom trip or an MDMA experience, or are there noticeable differences, generally speaking, in that experience from between the drugs?
There are noticeable differences, but I have seen and had different experiences in which each one of them kind of elicited a profound moment and that was unique to each substance. Like with most psychedelic experiences, no matter how good the last one was or how much you try to replicate it, you're never going to be able to replicate that psychedelic experience exactly the same. So whether you're doing ketamine or you're doing psilocybin, it's not going to be the same no matter how much you try to control it. But I do think that each one of them has their own unique flavor and experience. And, when patients ask, is ketamine more like a psilocybin experience or more like an LSD experience? Well, it really depends on what type of experiences you've had in the past.
Yeah.
But I have found that psilocybin is much easier to manage. It's much more lighthearted. Typically, it's more commonly associated with, kind of that giggle factor of that euphoria, you get a stomach ache of laughing about laughing. Sometimes LSD, man, it's one of those where you're locked and loaded and you're along for the ride. You're just a witness that's seeing what's happening, and you really don't have much control over what direction it's headed. Yeah. So ketamine, it's dose dependent. If you're on the smaller end of that dose, it's much easier to manage and you can redirect your thoughts a little bit easier. But as that dose starts to escalate, then, you're getting more into a psychedelic trip that is more analogous to like a LSD experience. Although it's not eliciting the same degree of hallucinations or, the sensory modifications. And it's much more short term.
Yeah.
The problem with LSD is you don't know how long it's going to last, actually.
Yeah. Yeah. So it is more analogous to like an LSD trip, generally speaking, than it would be, an MDMA experience or a psilocybin mushroom trip. Is that fair to say, generally speaking?
I would say based on the level of dissociation.
Okay.
So if it's a low dose and you're getting, minimal dissociation that's very partial, and, you still have a high degree of, ability to recognize that you're in the room, then it's going to be much more like a psilocybin. But when the higher the degree of dissociation, the closer you get to 100%, the more of a psychedelic experience, more mystical experience is going to be.
Okay. Which would be more in the league of like an LSD trip. Okay. Yeah. Last question I want to ask you. We're kind of, I feel like in the culture, we're at this, this precipice, or probably not precipice, but we're at the cutting edge of, or your clinic is sort of ahead of the curve. It seems like there's just this sense I get that, we're at the very beginning of having clinics like this in my lifetime and in your lifetime becoming far more common. Oh, yeah. Where people who are desperate for help, even for lack of a better phrase, a normal person, but everybody deals with hardship in their life. And then there also are people walking beside us in civilization who have extremely difficult psychological lives, who are desperate for help. And I think a lot of them, as we've talked about, are soldiers who have experienced enormous amounts of trauma, who are far more desperate and in need of help than the average person. But both people probably could significantly benefit from at least an attempt at helping them. We're talking in 2020. Talk to me about, in the year 2025 or the year 2030, in the future, but not too far away. How do you see substances, psychedelic substances like ketamine, like psilocybin, like LSD, like MDMA? What do you think is the most likely future for therapeutic usages of these drugs that we will be seeing in short order, potentially in the US and even around the world?
Depends on what happens November 3rd. So, that truly is kind of the biggest influential factor on what's going to happen over the next, 4 to 6 years. If things stay the same. The climate doesn't change. I think it's going to be slow for, our nation, our society just as a whole, to kind of grow and evolve and adapt to these new modalities of treatment. I think that it would be ignorant for us to sit there and just to dismiss the medical impact that these substances can have. MAPS has done a significant job with trying to reintroduce psychedelics into mainstream practical use, and they've done an excellent job with it. Microdose is a company that's, working with other, like Bex and Biomedical, and there's different companies coming out right now that are specifically, pharmaceutical companies that are looking at manufacturing, like, the big 5 psychedelic medicines. An entire pharmaceutical company is just looking at manufacturing psychedelics. And that's something that's just been unheard of in the past. I mean, nobody would have ever considered putting that together, 5-10 years ago, because psychedelics have been so far out of our reach from anything that a normal, average common layperson could get their hands on.
Yeah.
The accessibility has improved dramatically over the past few years. I would say probably since, around 2015, 2016, slowly, this has caught on to be more of a mainstream treatment. Ketamine clinics have increased significantly from, going maybe, a couple dozen clinics in the nation to now, it's in the hundreds.
Yeah.
And the biggest concern, obviously, is the rate of the growth and the control of the growth. MDMA, psilocybin, they're going to come on the market, I anticipate, within the next 2 to 3 years. If you want to stay innovative and on the cutting edge, like you're talking about, and you've kind of entered into the ketamine market world, I think that it would be a good idea for you to start to consider these other psychedelics as legitimate forms of therapy. And I think it's our duty to offer those if they are available, regardless of the cost or the amount of money that you can profit from it. If one person may respond to ketamine and another person may respond to MDMA and another psilocybin, and it's available and it's accessible, I think clinics should offer it. Hopefully with MDMA and psilocybin, the process of the clinical trials and the FDA stuff doesn't, water things down whenever it comes to the accessibility and the market of it. With Spravato, that's my biggest concern, is that, we're going to figure out how to, do the dosing for psilocybin and, kind of hit the nail on the head, but it's going to be some, bureaucratic reason on why we can't, offer the genuine 100% effective molecule to the patient. Something of that nature. It's going to come around. It's a movement. It really is. The psychedelics are starting to be reintroduced back into medicine. And it's always nice whenever you can turn on the TV and, albeit Netflix for now, go on there and, get the history on some actual legitimate information on psychedelics and how they were used in the past. And I mean, just do a little bit of investigation on the history of psychedelics, you're going to find that they've been around a long time. So this isn't anything new that we're stumbling into. It's a rediscovery. It's a reemergence. And the more accepted in the mainstream population, and the less we can, have stigma associated with psychedelics and abuse and, mental health in general, the better it's going to be for everybody. I definitely think, if you're 18 years old and you're looking, for something to go into for a career, psychedelics is an emerging field. And it's legitimate, and I think it's going to be there for quite some time.
As a quick follow-up to that, where is the resistance coming from, right? I mean, you've talked about how effective these trials have been in showing to improve the lives of people who are really suffering. Where is the resistance to, at the very least, like providing those therapies to people who really need it coming from in these days?
One of the big parts that this has been a huge issue with our civilization as we've evolved over time. Anything that may disrupt the ability for a large organization to control a population is always scary, and it threatens that structure, the underlying bureaucracy, no matter what it is. And I think that the fear of what could happen if, it's kind of the same things that, Nixon played off of, about marijuana being, the devil's grass. And, it's going to break down the whole family unit and just, corrupt our society. I think it's, it's going to be a process for us to get out of that mind frame.
Yeah.
And it's going to take a couple generations for us to truly evolve past that, where we're a little bit more open and accepting of it. But, we've seen a lot of evolution and progressiveness over the past 20 years. So I'm hopeful that, that highly conservative, and I think it's almost just an ignorant mind frame to be stuck in, that regulates, what we have as available commodities.
Yeah.
Hopefully that will slowly get eroded over time, and our medical community will be a little bit more progressive to accepting alternative therapies as mainstream therapies.
If you had to bet, would you bet that will continue to happen?
Oh, yeah. Yeah.
Jon, thank you so much for the time. I really appreciate it.
No problem. It was a pleasure to be.